Great. Well, thanks everyone for joining. We're really excited to start today. Today, we're going to be talking about cannabis safe storage and preventative messaging for parents. Specifically, we're going to be addressing cannabis use for parents and pregnant and breastfeeding populations. So now that everyone's joined, answered some questions, we still might have some few trickling in, but we're going to go ahead and get started. So thanks for joining today. And we're going to get started. First, I'm going to pass it off to my colleague and partner, Anna Meyer, so she can go ahead and welcome you to our webinar.
Great. Thank you, Sarah. And good morning, everyone. Thanks for joining us for the Cannabis Safe Storage and Preventative Messaging for Parents training. As Sarah mentioned, if you could please respond to the pre-training questions as you're joining, we would really appreciate it. And if you attended our first training session on social marketing best practices to address use cannabis prevention, you might already know who I am, but I'm going to give my whole spiel again anyways. So my name is Anna Meyer, and I'm an overdose prevention specialist with the Missouri Department of Health and Senior Services. My role at the department involves working on our substance use disorder grant program, which is a state authorized program that's funded by taxes on the retail sales of non-medical cannabis in Missouri. And the grant program aims to provide accessible community grants that support and expand services that relate to SUD prevention, recovery, and treatment, with that overarching goal of the program being to improve health outcomes and reduce the prevalence of SUDs and drug related harms, such as overdose. So, for more information about the grant program, I invite you all to please check out our program website and email our program email address, both of which I'm going to share here in the chat soon. You can use the email address to be added to our serve list or shoot us a question that you may have. And then the website is where our grant opportunities will be hosted once released. But then another important aspect of my job at the department involves participating in cannabis prevention and education initiatives. So this training, along with our previous training, is intending to be a precursor for some upcoming statewide cannabis prevention campaigns. So today we're going to look over safe storage and preventative messaging, targeting parents, pregnant, and breastfeeding individuals, really focusing on how to convey those clear communications about risks and promoting informed choices when it comes to cannabis use to safeguard younger children. So again, thank you all for being here today, and I will pass it back to our two presenters from the rescue agency, which is Kristen and Sarah.
Well, thank you, Anna. Um, and thanks for that great introduction. Just to give you a little bit more background on who we are, my colleague Kristen Isaac is the Vice President, Group Management Director of Cannabis Control Programs here at Rescue Agency. In her work, she oversees multiple public health campaigns and teams to promote health and behavior change and youth prevention campaigns across 15 different states. And I am Sarah Grace. I'm a Senior Account Manager here at Rescue Agency. I'm a cannabis specialist, and I also co-chair the Latino Audience Division to make sure that we are making authentic campaigns for our Latino audiences across the states. So to get a little bit more into why we're here, we want to take a look at the national context. So when we look at this, the cannabis landscape across the United States remains really in flux. Currently, 24 states have legalized recreational cannabis, while 38 states permits its use for medical purposes. Now, despite all of this, cannabis is still a Schedule One substance federally, meaning no accepted medical use and high abuse potential. Now, there is a reclassification to Schedule 3 that is under discussion, but we don't really know when this will pass. Because of this, there really is a lack of clarity that creates inconsistent guidelines, fostering misinformation and confusion. And as public health professionals, we have an opportunity to bridge these gaps with a clear, factual communication to protect our communities. So the problem is that this really leaves people confused and allows for misconceptions on how laws and the substance may affect them or those they care about, as the cannabis research is ever changing and ever evolutionizing. Now, before we really jump into everything, I'm going to ask a poll question. We're going to have a few of these throughout the session. So go ahead and feel free to answer the poll that has popped up on your screen. You should be able to go ahead and answer those now. And then as that's happening, we are going to be having a Q&A session at the end of this presentation. So feel free to use the Q&A tool at the bottom of your screen to input any questions that you might have throughout the presentation. That way we can make sure to answer those at the end. All right, looks good. Um, it looks like we got most of our answers in. So let's go ahead and take a look at those answers. And happy to see that a lot of people put to alleviate symptoms of anxiety or depression. We're going to get a little bit more into why this is, why audiences feel and use cannabis for the reasons that they do. But what we do typically see across research from multiple states is that these priority populations are using to alleviate symptoms of anxiety or depression. So, over the past decade, we've had the opportunity to work with some of the states who have been on the forefront line of cannabis legalization. Through this, we've conducted research with hundreds of adults of legal age to really understand their knowledge, beliefs associated with cannabis use, and their general attitudes towards cannabis in general. Through research, we've heard the following. We are able to get qualitative and quantitative data, but specifically, some of the things that we hear from our parents are, for example, one person said, usually in a jar, the actual marijuana buds in a jar. I usually keep them in my room. I like to keep it away from the dogs and the kids. I don't think it's not harmful. I don't believe it's harmful to pet or kids, but it's just privacy to myself. Someone else said, I would not use medication or pills. No, even if the doctor gave them to me. I'd rather smoke marijuana. I don't know. I believe that pills do more harm than marijuana. It's more natural and healthier for the baby and for me too. So, as we can see, adults have a lot of varying perceptions when it comes to cannabis, the risks, and the safety on their own bodies and their children. So, this is something that we are wanting to address in our messaging in a thoughtful way. Now, as the landscape across the United States continues to change and the research on cannabis is ever evolving, what we do know is that according to the CDC, some research shows that using cannabis while you're pregnant can cause health problems in newborns, including lower birth weight and abnormal neurological development. The CDC has also reported that breathing cannabis smoke contains many toxic and cancer-causing chemicals that are found in tobacco smoke, and also that THC, the psychoactive or mind-altering compound in cannabis, can also be passed through infants through secondhand smoke. And lastly, the potential health effects of use of CBD products during pregnancy are also currently unknown. So again, there's a lot of variance in what we do know about cannabis. This is the official reporting from the CDC. And as things continue to develop, ideally, we want to make sure that our audiences are safe and using responsibly, and maybe that means not using at all. When we look at the parent audience as well, we also know that there is a huge importance around safe storage. We know that after birth and as young children grow, that locking up cannabis safely is crucial to make sure that there are not accidental ingestions. In Missouri specifically, there has been a 600% increase on the number of children 5 and under experiencing cannabis poisoning that resulted in emergency room visits or hospitalization since 2018. Now, the National Control Centers have also documented that approximately 2 in 5 exposures of Delta 8, an unregulated intoxicating hemp product, are also occurring in children. So again, this is something that we are seeing on the ground level. So we want to make sure that we're really addressing this without judgment, but really helping our audiences understand these risks and get the information they need. So what we need to do in this case is to really provide our priority population adults with the go-to source of tailored, non-judgmental, realistic information so that they can have the tools and skills they need to make informed decisions about this, newly legal substance in certain states. Again, this could be for anywhere, but for today, we're looking at Missouri. And also be able to have informed conversations with those that they love. Looking at these priority populations, today we're going to be focusing on pregnant and breastfeeding people and adults or parents or guardians that are impacted most when it comes to adult cannabis use. So those who are, parents, guardians, mentors, anyone who is around young children. For both of these audiences, we're really looking at increasing their knowledge, attitudes, and beliefs around cannabis use and the impact that it can have on their bodies and children. For pregnant and breastfeeding people, the ideal messaging is to pause use. For adult parents, caregivers, and mentors, we're looking at safe storage. So for today's presentation, we're going to be taking a deep dive into those audiences and specifically a little bit more into pregnant and breastfeeding people as the cannabis research is very scarce on this subject. And so we want to take a look at the research with them, and then we'll also share some safe storage best practices. And we got another poll for you. So for this one, go ahead and answer what's on the screen. This question is, what is one of the obstacles that the audience faces regarding the use of cannabis? So there's a few different options here. Is it they have a very high level of trust in doctors? There's abundant scientific research on cannabis. They have concerns about the impact of cannabis on their baby, or there's strong motivation to stop using cannabis. Maybe. All right, we're getting some answers in. And don't worry, we'll go over the answers with some research after this poll. All righty, I'm gonna go ahead and end it. Thanks for answering. And let's go ahead and see what everyone said. So we got a little bit of different answers on this one, but the majority of the answers did choose concerns about the impact of cannabis on their baby. That is the correct answer here. There are a lot of different, obstacles regarding the use of cannabis, but really the biggest one is having concerns about the impacts of them and their baby. So let's go ahead and kind of deep dive into why that is, what we learned from our research, and how this audience really thinks about cannabis use. So we know that according to the American College of Obstetricians and Gynecologists, that 34 to 60% of cannabis users continue to use during pregnancy, with many believing that it's safe to use while pregnant. As cannabis research continues to develop, we recognize that safe use is priority use, and that includes abstaining from cannabis while pregnant and breastfeeding. Because of this, we chose to conduct research to really identify why this population chooses to use and what obstacles they face in pausing use while susceptible. In other words, we decided to explore the knowledge, attitudes, and beliefs and behaviors regarding cannabis use. We wanted to explore which social norms, values, activities, and environments are more likely to encourage or discourage use. And lastly, to assess receptivity to messaging areas and ads that really identify preferences in style, tone, and framing. So here we're going to be going through the different takeaways of what we found during this research that we conducted across multiple states. Ultimately, what we first found is that participants have changed how much and why they use cannabis over time in response to being pregnant and or breastfeeding. First, we had participants overwhelmingly report that their reasons for use are for healing, self-medication related, regarding mental health. Participants also shared that cannabis provides relaxation and relief from anxiety or depression. One participant said, "It's not even a party thing like people think it is. It's just to help me relax or cope. You can't take any pills or medication when you're pregnant, so you have to find alternative methods to help relieve." We also heard from participants that they adjusted their frequency of use as well as the amount they were using and said that they only used enough marijuana to achieve the goal of relaxing or relieving stress. They associated a higher frequency and the amount of use with social or recreational marijuana use. So again, they're kind of decreasing their use, but they are still using in this case. Second, participants did have concerns about the impact of cannabis on the health of their baby as well as the health of the birthing parents. Some mentioned that they didn't want to carry the guilt. Someone said, if you do something and your baby ends up hurt, you're going to blame it on yourself. There's not enough research on these things to say if it's safe or not. Ultimately, many moms wondered how using cannabis or using cannabis differently, excuse me, was from the other forms of medication. And one said, part of me is like, what's the difference between taking medication when you really don't know what's in the medication and another substance? So again, there's a lot of confusion, misinformation, a lot of hearsay. People are trying to connect with other parents to see what they think. So again, a lot of variability in the air. Next, we saw that participants were aware of the stigma associated with using marijuana while pregnant and or breastfeeding. This was really interesting because this alone tells us that the stigma is not enough to motivate them to reduce or stop their use. Many felt that the stigma was not warranted given the lack of clear evidence of the impact of cannabis has on the birthing parent and child. Some moms also mentioned that they would turn to edibles in order to hide their use from the people they live with, specifically older family members. So again, this is a really good key takeaway. The stigma is not enough. So there's something more rooted that we need to really understand and get to if we're going to be talking to these audiences. Next, participants prioritize the information from those who have had personal experience with use while pregnant and or breastfeeding. When asked about who they sought information from, they said they went to people who had given birth first. This included influencers on TikTok, Facebook forums, and pregnancy apps, as well as direct connections like friends or family. This may also be driven by the desire to avoid judgment from others. Many share that there's not a clear evidence pointing to the risk of cannabis use while pregnant or breastfeeding, and because of this, participants share that they're more likely to rely on personal accounts from lived experiences as opposed to health organizations. Some moms said the doctor would not have the information that they were seeking either. One person said that doctors wouldn't know about safe cannabis use because their whole thing is about medicine. Many participants felt that the information they would get from a doctor, if they asked, would be biased towards not using cannabis, even though, and one person said, they really haven't done studies on if it's really safe for you to do that while pregnant. So, again, a little bit of lack of trust in the medical system and doctors. So, they're really relying on friends, family, those personal accounts. And finally, one of the last main things I wanted to share from the research is that moms emphasize that each pregnancy is different and that people needed to do their own research and pay attention to the needs of their own bodies. They felt that the information that they gathered would be filtered through their own pregnancy or breastfeeding experience. As one participant put it, you know your own body. Some participants heard that using cannabis while pregnant was more risky, while others heard that using it while breastfeeding was more risky, meaning parents' perceptions of risk were really influenced by the variation in the information that's available. So I know that was a lot. So we tied it all together in a audience obstacle recap slide. This is a really great slide just for you to reference for your own messaging and communications. We will be sharing out this deck at the end of the call along with the recording, so no need to take a lot of notes. But again, this is just kind of a nice recap. So knowing that all of these insights, there's the lack of trust in doctors, lack in science, lack of motivation to stop using from the stigma, the concern about the impact it could have on their own baby and their reasons for use being mental health focused. With all of this all together, how do we create effective messaging that really motivates this audience? This is a lot of different buckets to cover. Now, before we show you how we do that, I'm going to do one more poll question. Well, there's still a couple more poll questions, but another one before the creative. So go ahead and answer on your screen. This one is, what are the two key elements to consider when educating individuals about cannabis usage? And we're going to be sharing this cannabis communications overview. So this is a little test before we get into the actual content. Go ahead and answer on your screen. Alrighty. I think we're looking good. I'm going to go ahead and end the poll. All right, so we had a few different answers, but a majority of you all picked tying unsafe usage to an end result and connecting behavior to personal risks. This is the correct answer. Again, we want to make sure that we are really connecting to our audience and their reasons for use. So with that, I'm going to pass to my colleague, Kristen Isaac, to walk us through some of that creative.
Thank you, Sarah. And I am hoping that everyone is learning a lot. I'm really excited to introduce the strategic approach of how we can effectively reach these audiences across pregnant and breastfeeding people, and then parents and guardians and caregivers. So we want to go to the next slide. As we just learned and essentially gathered from the section and all of the interesting statistics and insights that are coming out of the state of Missouri. There's one common thread that we can really look at as we appeal to these audiences. So, in the development of communications messaging. So, the first thing that we really want to understand in how we can neutralize a lot of those obstacles that we just uncovered with all of the research. The first one is how. So, how can this affect me? And really putting ourselves in the position of the audiences that we're intending to communicate with. So, this is really going to allow us to unpack the risks and the benefits. So, how we can help our audiences understand tying unsafe usage, tying unsafe storage practices to an end result to make sure that that end result is also corresponding with something that is deeply motivating to them. So we're able to connect the dots around what this means for them in the context of their life. We know that pregnant and breastfeeding individuals and both parents and guardians, depending on your status, you have very, very real reasons for potentially using. And we want to make sure that we always approach our audiences with empathy and understand where they're coming from is as we craft communication messaging. And then the next piece that we're really going to dive into is why should we care and connecting the relevance of cannabis and showing them how it applies to them depending on their starting point. We know that all of our audiences have different starting points, so really understanding the reasons why they should care about this and how it would potentially impact something that they personally care about. So if we go and we look at the audiences that we're trying to serve, what we're going to do now is really just unpack this a little bit more, and I'm going to recap a little bit of what Sarah said, but with a different lens, because when we're thinking about the significant risks, for example, of pregnant and breastfeeding adults, and that those impacts on infant development, including those potential neurodevelopmental effects, we know that pregnant and breastfeeding women truly care about the development of their child. We also know that a lot of stats and a lot of facts that we're seeing in all of our research is that they have very real reasons for using to cope with mental health and other behavioral stress and other obstacles that they might be experiencing. So the message here is to not shame them or act with judgment. Really, what we want to convey to this audience is the reasons why they should delay or pause usage at this very critical point in their infant's development. So really just helping them understand that this is a crucial window for their child. And the other piece that we just also want to emphasize is when we're able to also do this and pair it with alternative resources to help them, because what we don't want to do is just ostracize them and take away something that might feel like a very legitimate coping mechanism for them. And so that is why I'm so excited to also be talking to all of you amazing individuals on the line, because I'm sure that many of you are also working with these audience as well, and just making sure that we're always doing what we can to pair resources when possible in the absence of something that they're leaning on for that emotional and behavioral support. And then when it comes to parents and guardians, we also understand that based on the work that we've also done in other states, the stats out of Missouri are really staggering. But when we do see cannabis become more legalized in a recreational environment, there are a lot of potential consequences with those unintentional ingestion risks, often leading to emergency room visits. It creates a lot more financial strain. It can be avoided. I think that's the other big thing to mention is it's so easily avoidable. And until there is unifying messaging between cannabis dispensaries and the regulatory environment and at the federal level, we are operating in a really disparate point of sale environment. So I saw someone in the chat mention that you're still seeing dispensaries kind of pop up, and that's because there's a lot of loopholes. And when you think about that point of sale, there's not necessarily information that's being required of, that point of sale to make sure that you're practicing safe storage best practices. And so it really does put the burden on organizations and CBOs and at the state level to make sure that we are doing that work for them if they're going to continue to access cannabis. So the piece here is really making sure that we're not shaming people again, but really just around emphasizing safe storage, moderation, and talking to your youth about cannabis. So the ways that we're going to be thinking about this from a communications perspective, and just really unpacking kind of like what exactly does this mean and how do we do it? Ways in which we found a lot of success in communicating with these audiences is that potential impact on that neonatal development, right? So brain development and birth weight. We all want to have a healthy infant come into this world. And so really understanding how explaining THC can harm the development of your baby, how THC can effectively reach your baby through breast milk and the bloodstream, and then ultimately just helping them really understand that there is no safe amount of THC. And a lot of this too, it's like we're looking at the research, but we want to make sure that we're pointing out that there is no necessarily safe amount of cannabis use while pregnant and breastfeeding. So that way, they are equipped with the information, they can make that decision. But ultimately, this is the most impartial way to communicate with our audience while not necessarily Again, just removing something without any explanation. And then when we're talking about responsible use basics, the pieces that we really want to emphasize here is that safe storage. So reminding our audience to store all marijuana products safely in a locked box or secure location, and providing information on THC potency information just in case there is accidental ingestion, but also helping them understand the gravity of the products that they are consuming now. Marijuana products look very different from where they might have been even 10 years ago. There's a lot of synthetic, there's a lot more higher potency. And because it's so vastly unregulated with all of these loopholes that also exist, it's really critical that our audience understands just the gravity of this. So it continues to be top of mind and we do not have any accidental ingestion. So with that, we love polls and we love getting your feedback. So the next poll that we're just going to throw out your way is, which of the following strategies is the most important when providing information about cannabis use and its effect on a growing infant? Is it one, promoting the idea of just being the best mom, providing non-judgmental and empathetic information, maybe using vague languages to keep our audiences unsure, or is it focusing solely on the benefits of cannabis? And I'm seeing 23. Oh, good. I mean, one of these is kind of a trick question, the vague languages to keep our audiences unsure. So I'm glad no one is picking that. But ultimately, and I like that I'm also seeing promoting the idea of being like the best mom, promoting the idea of being the best parent. Because the other thing is that we can also reframe the way we're talking about parenthood in the context of still conveying non-judgmental and empathetic information. So, really great job. And as we go into, ultimately what those messaging layers should be in communicating with pregnant and breastfeeding women, what you're going to want to do is focus on communications that, again, personalizes and contextualizes their use to demonstrate how cannabis use can affect a growing infant. And this includes that prenatal development period and really making sure, why should they care? There's still a lot of unknowns about how cannabis use can affect a growing infant, and our goal here is to make sure that we're able to understand our audience's starting point, which we talked about at the beginning, and understand how we can tailor messaging to be more relevant and personalized to these higher risk audiences so we can talk to them without this shame or judgment. And then again, just to further emphasize, when we can do this and also pair it with helpful resources, this is especially impactful because there are many sensitivities, especially with this audience. So we really want to be empathetic to make sure that we're doing what we can to alleviate the very legitimate symptoms they may have with anxiety or depression. So I'm going to show you a couple examples of how we've done this. And as you're watching these, I want you just to really think about how could this show up in some of the communications that I have with this audience, if this does apply to you and your organization, and what could you potentially shift in your communications to have this objective approach. So let's go ahead and watch an example here on this example.
As moms, we make a million choices every day, but not all choices are obvious. For example, is it safe to use cannabis while pregnant or nursing? Science is showing THC can harm your baby's growth. Learn more at letstalkcannabisil.com.
So I think what I really like about this spot before we play the next one is that it shows the actual circumstances of a mom being a mother and folding clothes and really going through that thought process of how exactly can this affect my child, and essentially dispelling possible myths that they may have heard on the ground or within another social setting. So I really like this spot just because it shows the very real circumstances, and it's not just someone on camera saying don't use marijuana or cannabis during this, this critical infant development period. So let's go ahead and watch this next one.
You and your baby share a connection. They recognize your voice. Their cravings are your cravings. You even have the same taste in music. And whether you're expecting or nursing, if you use marijuana, you're also sharing that with your baby. Studies show the THC in weed can affect baby's brain development and stay in your body for 6 or more days. Help your baby get the best start possible. Learn more at letstalkcannabisil.com.
And I think the best part about this communication is that end tagline that you heard, help your baby have the best start possible. And what we're doing here is we're playing to the motivations and the things that we know that our audience cares about and doing that in a way that still conveys that end goal of reducing cannabis use during that neonatal development and during that infant development. So these are just some additional examples that you can see that we've developed in our pregnant and breastfeeding campaigns, and ultimately hearing from the lens of a mother, right? Testimonials would be another great tactic as you're developing your communications materials. So just really making sure that we're putting ourselves in the position of someone within these circumstances. So it feels very real, it feels warm, it feels empathetic, and it does not feel judgmental or shaming. So, what just to keep in mind with this audience, as we already reiterated, there's just a lot of misinformation. There's a lot of statistics out there that we can pull from to make sure that we're operating in an evidence-rooted approach. So, the challenge that we're ultimately trying to overcome when communicating with this audience is that they just don't know or believe that the risks associated with cannabis use, and they find it hard to find clear and unbiased information of how cannabis use affects their baby. So whatever you're working on within your communications approach, just making sure that that non-judgmental, trustworthy, empathetic information is transparent about the information that we do know versus what we don't know. And the interesting thing about this topic, it's one of the reasons why I love it so much, is that research is continuing to evolve. And so as we continue to get more research, this is something that will continue to expand. But just making sure that you're equipping them with the things that we do know. And then it's up to them to make that decision. But ultimately, we do find that once people are offered, research and you pair that with those motivations, they usually make that choice moving in the direction of the thing that they are motivated to do, which in this case would be protecting their baby. Okay. So this brings us to our another poll. We love our polls. So what is the most important message to convey to parents about cannabis use in children? So cannabis is completely safe for children. Accidental ingestion can have serious consequences. The effects of cannabis on children are widely known, or none of the above. And we're moving into safe storage practices now. So if you hadn't guessed. Okay. So the most important thing that we're going to talk about next is how cannabis can have and the accidental ingestion of cannabis can have very serious consequences. And unfortunately, as we've covered quite a bit in this webinar training, is that there's just a very wide range of cannabis products out there. And we do unfortunately see the cannabis industry and other folks with dispensaries who might be getting within those loopholes, they're doing a lot of the similar things we've seen within tobacco. So it looks like candy, they're list chips. I mean, it's I'm happy to share some additional slides as well when we send this over so you can see the similarities. But it's really troubling too because cannabis also shows up as gummies and that looks yummy. It looks like candy. So what we really want to focus on here from a target audience perspective and our ultimate messenger who can essentially prevent this very preventable challenge is cannabis using adults, those who potentially see minimal risk of use, and those who have children and pets, because we also do see this in pets. And that is very troubling as well. So the piece that we want to focus on is how to use and store safely. And what we want to really think about too is from the lens of our audience, I see little to no risk in using and storing cannabis in my home. And so what we really want to aim to do here is create a stronger sense of relevance and urgency and emphasize the gravity of accidental ingestion and make it feel like it could happen to them because it very well could. And it's just, kids and, young kids, even older, if you're the packaging when it's unclear, we really need to make sure that we're doing everything we possibly can to prevent something like this. So What we're going to do next is walk you through a couple of examples of how we've done this, or sorry, just the one example. And ultimately, this is a spot that came out of the state of Illinois. Just as context, where again, we're seeing a lot of accidental ingestion of cannabis use. So making sure that they just really understand how quickly something like this can happen and making sure that they are completely heightened in terms of their sensitivity and protecting their child or anybody in the home from this ingestion. So let's go ahead and watch the spot called It Takes Seconds.
In the 15 seconds this video takes, a child can get into something they shouldn't. Like right now. Cannabis edibles look like regular candy to kids. Lock and hide your stash today. Learn more at letstalkcannabisil.com.
So you can see, and that's again, just I think the other piece that I just want to emphasize with all of the different examples is just making sure that it feels very relatable and it feels very accessible. That is a normal mom coming home, something slips out of her bag. My kids still find candy and they just sneakily will eat it. So just making sure that we really understand that it's not something where you're doing a bad job, you're being a bad parent. It's just really understanding the risks that come with legalized cannabis in this environment. So the piece that we really want to convey here when we're thinking about the challenge is just making sure that we understand parents are busy. They're not thinking about securely storing their cannabis from kids. They perceive it potentially as low risk because they are using it. And they also don't realize that edibles look like tasty treats to children, or maybe they don't think that it's something that, just like leaving it out on a counter or something like that. So we really want to make sure that we're helping our audience understand just how quickly something like this can happen to prevent these accidental poisonings. And as you saw in that spot, there's also tips that come with that set of communications of, a locked kind of like zipped case very up high so no one can access it. So making sure that you're walking them through all the different ways that they can safely store their cannabis. So with that, I think we are going into a recap of hopefully all the amazing, helpful things that you have learned today.
Thanks, Kristen. All right, everyone. I know that was a whole lot of information. We're coming to the end here. And this is a lot of text on screen. Do not worry, you don't have to read all of this. Again, we're going to send a copy of the deck over. But these are really nice little cheat sheets just to have, excuse me, as a breakdown for each of these audiences. Ultimately, for a pregnant breastfeeding audience, here's all the learnings that we have. Ultimately, like those who have used cannabis before sometimes continue to do so while pregnant. They use it as a sleep aid and relieve other mental health symptoms. Also, that other moms are their number one influence. They're really driven by their peers. They're also searching for clear information. They want unbiased information on cannabis during use, but that can also be hard to find and to understand. There's also that distrust of health providers. And so they don't really trust medical providers with questions about cannabis in fear of being judged or tested. There's also stigma and fear of judgment. Typically, if this audience is using, they hide their use from their parents and partners and families due to their different beliefs, and they don't want to be shamed. There's also that message sensitivity. They don't respond well to messages that invoke feelings of shame or blame or being told that they're bad moms. There's also more to learn. They recognize that and they respond better when sources and authorities admit that they don't know everything about cannabis and how that really affects their pregnancy or baby. There's also the want to not quit. Sometimes they are more receptive to messaging that tells them to wait to avoid all potential risks versus just to tell them, to stop completely. So, quick little recap for our pregnant breastfeeding audience, for our adult mentors and parents who, have pets, young children. Ultimately, for cannabis use, they use to manage daily stressors, and ultimately the goal is to keep it away from their kids. There's also that social norms have not been established yet. Parents may not feel comfortable discussing their use with other parents, or sharing tactics about that safe storage. It's also hard to imagine the risk to kids. Sometimes, the parents might not be concerned with pets or children getting into their cannabis. There's that lack of risk perception. They're unsure of the impact as well. They're unsure if it's really toxic at all to kids. There's also the reduced perception of risk. Before legalization, the risk was perceived to be legal in nature, not medical. So without legal risks, the audience doesn't really see the impact of or the harms of cannabis use. There's also that message sensitivity. It feels a little extreme to lock up cannabis products when most adults don't lock up alcohol anymore. So they feel like maybe it's a little bit, overkill. There's also more to learn. They aren't aware of the signs of cannabis usage in kids and pets, and so they're not sure about using, or they're not sure about the legality of using. And lastly, ultimately, we want parents to lock it up, and we want to help them believe in the risks and normalize the idea that cannabis products do need to be secured. So all that to say, I got one more takeaway slide here. This is really easy for your cannabis communications that you're sharing out. Ultimately, we want to avoid promoting like being the best mom. We don't want to make people feel, judged, things like that, avoiding statements that are vague. We also want to include cannabis forms that are easily recognizable. You want to utilize messages that promote pausing use and develop audience relevance and relatability through those shared experiences. For safe storage, ground the audience in already accepted behaviors like that locking up alcohol, develop audience relevance with realistic experiences, and also educate on the risk of accidental cannabis ingestion to establish that need. And finally, utilize messages that are non judgmental to be easily actionable. Now, I know that that is a lot of information in terms of messaging. We also want to make sure that we're providing you with practical tools. So we have linked a few different additional resources. Again, this is going to be shared out. There is the In the Weeds powered by Prevent Ed webpage, and this really provides age-specific talking kits to have conversations at the kitchen table, podcast episodes about answering audiences' questions, and also in-person programming delivered by Prevent Ed's staff. There's also the Missouri Poison Control for around safe storage, poison education for communities on poison safety. They also have toxicology advice and care from registered nurses and pharmacists. So you're able to kind of have that chat to make sure, what's the toxicity levels, things like that. And lastly, we also have just a few different linked resources. So for these ones, there is the, what to do if your child consumes cannabis. We have marijuana information and preventing childhood poisonings, cannabis ingestion data. And then also we have linked the DHSS has the unregulated psychoactive cannabis product enforcement efforts. So that's kind of like a summary of everything that is happening on the ground level. And with that, I'm going to go ahead and open the floor for Q&A. So this is going to be our Q&A portion. There is the Q&A feature at the bottom of your screen, so you can go ahead and type in questions there. I'm going to go ahead and take a look at some of these questions, and then we'll open up the floor. Let me see. Ashley says, is there any research about edibles rather than smoking harming children during pregnancy? In terms of that, I don't know, because we've conducted research about the different types of use. We do ask, what is the mechanism that you ingest cannabis by? And we have seen our audiences, the research that we shared earlier included smoking, edibles, things like that. We do typically see pregnant and breastfeeding audiences gear more towards edibles because they feel like it's a little bit more discreet. It's so they feel like they won't have that shame associated with it. But ultimately, we do not know the full research when it comes to cannabis. It is ever evolving. I think that any use, at this point, it's better to be safe and not use, even if it's an edible form. I don't know if we have anything specific research about edibles only, but I would still lump that together. Whatever the mechanism is, cannabis can impact your growing baby. Let's see.
One of the questions in here, I think there's a few questions from Carmen. So the first one, I will be developing a training for teen parents regarding cannabis and pregnancy. I work for WIC. Will you be sharing? So we can absolutely, I'll let Anna and Valerie speak to the outreach for WIC Association. In terms of teen cannabis use and teen pregnancy, one of the pieces, in terms of our communication tactics that we've typically taken, typically it works with, youth prevention. So youth 13 to age of like mid-20s. And then we've had communication specifically on pregnant and breastfeeding women. So to effectively reach a teen mom with this type of messaging. I think there's two things that I would really emphasize there, and I'd be also happy we could absolutely sidebar. And the pieces I would really emphasize there is that the teen brain is growing until your mid 20s. And so making sure that there's essentially many reasons why they should stop using if they're a teen, they're a teen mom. But ultimately, there is a lot of research out there now, thankfully, just about how THC can harm adolescent brain development, not just for your baby, but for yourself up until the age of mid 20s. And so when we think about the various obstacles and motivations that a young mother might have, I could envision many ways of effectively conveying that information, both from some of the examples that we saw here today with pregnant and breastfeeding moms, but essentially the motivations that a teen mom might have to really create like a better pathway for their child. So I'd be happy to pull together a couple insights and best practices that I would incorporate for your messaging within WIC. But I think that's a really great question, and it's a very important audience to make sure that we're getting ahead of. And then, so I have some thoughts and would be happy to, offline with Valerie and Anna and just make sure that we're able to get you the right information. And then, Sarah, there's a couple other questions in here
Yeah.
specifically on promoting the name cannabis versus marijuana, which
Yeah.
I feel like is a perfect.
Yeah, I can help answer that. And that's a really great question. I'm glad that you asked. It is something that that is a question in a lot of different states. Specifically, the state of Maine, Virginia, and Washington have moved away formally from the term marijuana. They have renamed their, offices of marijuana policy to Office of Cannabis Policy, because of the historical nature of the term marijuana, and that in the past it has been used as um, a way to kind of demonize Black and brown bodies, kind of like in the war on drugs era, things like that. So there is a complicated history when it comes to this term. However, at least from like, my personal stance, the research that we've done, and also that we have a lot of different state connections, depending on the audiences that you have, if you are trying to connect with Latino audiences, using the term marijuana is important because that is the term that is authentic to them. The most important thing is to not be using it in a way to harm, speak derogatorily towards any group of people. If you are just saying, the term marijuana, and maybe you're doing prevention messaging in communities that have high Latino populations, personally, I would encourage you to use that term because that's going to be the most authentic to them. Um, but if there's maybe a lower Latino audience, things like that, feel free to use cannabis. Cannabis is generally the safer term, if you will, across multiple states. So we do use it interchangeably, especially depending on our audience. Cannabis is also seen as a very technical term. And so, if we want to provide credibility, sometimes using cannabis is better because it's speaking from it from a very factual perspective. If you're trying to connect with audiences more colloquially, marijuana might be the better term, just because that's how people talk, right? Again, we want to meet audiences where they are. So it really depends on who your audience is, what community that you are connecting with. So there's a lot of nuance when it comes to this. Typically, cannabis is considered safer if that's something that you're worried about. So that's kind of Rescue's take. Not sure about Missouri, but yeah, I really, really enjoy this question. And I know we have a few different questions to go through, so I want to make sure that we are moving forward. Um, let's see.
So Erin asked, I have a client whose OB has said it's fine for her to use marijuana up until a certain point in pregnancy. She's about 30 weeks. You heard any research information on this? Feels difficult to try to educate the client on possible negative impacts when the doctor's saying it's okay. How would you speak to clients like this? So I think that there's a lot of I think the interesting part about cannabis is that there's so many examples like this where there's just misinformation and also understanding kind of like that range and spectrum of harm. And so in this case, I can't speak to what the OB would have said, but ultimately in how I would navigate that communication, I would continue to emphasize like compassion. So, like for example, it makes total sense that you'd want to follow your doctor's advice. There's someone that you trust and you see regularly, so you're bolstering that trust. What you don't want to do is create a divide between you and that client or you and that audience. and then, reintroduce the facts. So like that said, the most current guidance from leading experts like the Surgeon General and American College of Obstetricians and Gynecologists say, that THC can affect a baby's development. The data that we do have shows that it can increase some health and developmental risks. Reemphasize, like, no judgment. We're all working with the best information that we have available. And again, just like reinforcing that, like, we all want the same thing. And ultimately, in a case like this, it may need to be something like small steps, tapering to, ultimately provide that best outcome possible. So I think every situation will have a lot of nuance, but that is a very challenging circumstance. And I think so much as you can provide those precautions, non-confrontational language, continue to reinforce those resources, and that compassion will give you that trust that you ultimately want to maintain, because you're going to want to find that open door, that open window, to essentially try to motivate them to abstain from use if possible, or at least the very least use less or delay that use for a certain period of time to give their baby the best healthy start.
And then I know there were a few different questions on safe storage, how adults are reacting to that. Maybe locking up in a bag or a box just doesn't seem feasible. And what our audiences, what our adults really think about that. Again, similarly, in the beginning, if we're doing research with an audience where we're trying to gauge their knowledge, attitudes, and beliefs, there is kind of like a lack of need. Again, some of the quotes earlier, it's like, well, I don't think it's really harmful to children or my pets. Like, I think it's okay. Like, marijuana is a plant, like it should be natural. So there is kind of like a lack of need there. They don't really see the urgency or anything associated with that. In the terms of messaging, we really want to encourage, like Chris had mentioned before, those potency levels, that cannabis today is much more potent than it used to be. And also the impact that it can have on children, and including pets too, right? It kind of depends for our, parents who have children, making sure that their child's safety is the most important is typically a really good motivator for them. In terms of younger, young adults who might not have children yet, a lot of young adults, their pets are their children and are just as important. So depending on the type of age or audience that you're looking for your adults, making sure that the things that are most important to them, whether they're children or their pets, are being safe and avoiding that toxicity levels, is a really good way to provide that urgency, provide that need for them. So again, sometimes, adults might not see the need in the beginning, but once provided a little bit more information, typically it's a really positive reaction. Again, as long as you're not being judgmental, things like that, and encouraging the reasons why it's important, we typically get good reception. Let's see. And then, oh yeah, cost barrier to safe storage. And I also saw that lock boxes might be tough. Ultimately, an ideal world, a lockbox or a lock bag is great, because it's extra secure. Realistically, if there's a cost barrier to that, maybe in your messaging you can provide alternatives, things like storing at the highest top of your, kitchen cupboards, right? Like very high level, so that way young children, pets are not able to access those. So there are creative ways to make sure that cannabis is not being accidentally ingested. And I would kind of encourage those, both options. If you're able to go online and get a lock bag, great. If not, do what you can to make sure that it's very much out of reach. Let me see. And then, yeah, I see some asking for some resources on safe storage and other like breastfeeding things. We did link the resources in the deck that kind of cover accidental ingestions, and the research around these audiences, in terms of like actual storage options and additional information. We can go ahead and take a look and pull those. I don't think that's something that we have off the top of our head. So I'll have to do a little bit of pulling for that one. Okay, and then I think I are there have there been any questions coming in on the chat? I'm trying to see. Hearing these out.
Yeah, I think, one of the questions too on just like safe storage and receptivity with the audiences What's been interesting is that all of the research that we've done, and we've done it in quite a few states now, the audiences who are using cannabis really do care about their physical health development, the health of like their children, their pets. There's just a lot of unknowns, and even they themselves are not fully educated on the risks cannabis use disorder. There's just a lot of unknowns with this space, largely because of the regulatory gaps that we see both at the state and the federal level. And so once you really start to unpack all of it with them, they tend to be more receptive to the messaging. So, for example, like a practical, I think I saw something in here from Jen around it not feeling practical or realistic to like go put it in a lockbox. But when you actually understand and unpack how quickly like a poisoning can happen and how devastating that can be, and really starting to understand the potency and like the impact it can have, they do care. And I would say that has been probably one of the most revealing insights in all of our audience research, is that it's not that they don't care, they just don't have all of the information. And so that is like our goal here in the partnership with Missouri Department of Health and Senior Services, is to make sure you all have as much information as possible, so that way you can have those conversations and open up that door for receptivity, especially too when you're pairing it with the things that they care about. Like they care about their children not going to the ER with the poisoning. And I really, when you have again those conversations, it completely changes their perspective. And that is really the ultimate goal with all of this, is like, how do you change their perspective with the facts and then by framing it with the things that they care about? So hopefully that helps. I just kind of like wanted to add that layer and that nuance. Um, because I don't know, sometimes our audiences they're incredible and they all have kind of like their own reasons for use, and it's up to us to figure out like how do we break down those barriers and really getting through to them in the right way.
Um, and then I know there were some questions about the legality when it comes to minors using cannabis. I would defer to the state of Missouri to kind of help answer those questions. And again, like maybe this is something that we can follow up after the call, so we can go ahead and share out with you if that's a little bit easier, with some more additional information and things like that. So, but I just wanted to address like that question did come in. Um, I'm not quite sure on the legality when it comes to the state of Missouri. And then I know we're coming up on a close. And I think we kind of answered some of the lock boxes. You can, look up online for where to get different lock boxes, or there were some kind of creative things in the chat. So I appreciate everybody kind of sharing information. Um, and yeah, we can kind of follow up on the legality when it comes to minors and also using medical cannabis while pregnant. Um, Again, I think that's state dependent. And then I think that answers all the questions. Great. Well, I think that brings us to a close. We really appreciate you all joining our webinar today. We hope you found this really helpful. Again, we're going to be sharing out the deck and also a one sheet that kind of has best messaging practice takeaways. So you'll be able to apply these learnings to your own cannabis communications and efforts in your community. So thanks again so much for joining us today. We appreciate your time and hope you have a great rest of your day.
Thank you all.
Everyone.